First visit with us?
Tuesday.
Tuesday. Were you in a lot of pain then? Where, your low back?
Yep.
Yeah. So this is your third visit?
Yeah.
So from then until now, we haven't adjusted it. You did your exercises, right? What percent has the pain decreased? 50, 40, 60?
About 50. It's like all that pressure that was there that I felt, the tightness.
The tightness. Yeah,
it was real tight. I can turn and dance and all.
You could almost keep up with me walking across the floor.
Yeah.
Almost.
Yeah.
Is the pain worse in the morning or the afternoon?
In the morning.
Going from a seated position to a standing position.
Painful?
Up. Yeah. Getting up.
When I get up in
Once you get down there, you're okay. Okay. Did we give you exercises to do at home? Which ones were they?
Sitting down, and I don't know the name of it, but I sit down.
So she's doing Mackenzie, sitting,
and laying on
lumbar spine flexion. We also did on the back, but she progressed beyond that to sitting. It's more practical, but you can do it during the day, right? Right there. How many times a day are you doing the exercises?
5 to 10. 5 to 10 sets.
Yeah.
At least 5.
Yeah. So when I hear that, and she gets a platinum star, and I will warn you right now. Are you a screamer?
Yes.
Any profanity? No profanity?
No.
We'll see if we can fix that one.
I think I'm just more nervous than anything.
You're more nervous, okay. And relax. Let that knee drop.
Oh!
Oh, yeah, baby. Good one. Turn the other way. Oh, that was good. Turn this way. You have this, like that. And I want this right in here. Yeah, good. Bring this over. Like that. And that step. Relax. And just let it loose. That was a baby one for you. Back for me.
Oh, happy birthday.
So, I pulled your leg before, haven't I?
Uh-huh.
Yeah. So go ahead and just relax for me. There we go. Arms over your head. I don't know what to expect. We have not adjusted Deborah's neck yet, but she has some stiffness and a lack of mobility. So I don't know where this is going to go. Just don't hit me. Relax. And put your hands on your belly button. Yeah. Keep feet closer together.
Oh.
That was smooth.
Oh. You caught me off guard.
Oh, that was the whole idea. Drop this shoulder. Oh, baby. See, I should have showed you a pre. Go ahead and stand up for me. Go step off. Let me see you look at Liam. Turn left with your head.
Oh,
no, just rotate. No. Just we'll do the neck first. Look at that. Go back the other way. It's a lot better, isn't it? Yeah. Now lean to the left. So keep your right foot down. Now lean to the other side. Lean to the right. How's that feel compared to the other day?
It's better.
That's a lot better, isn't it?
Yeah. A lot better, but
who referred you?
I Googled it.
You Googled, Dr. Google. Why'd you pick us?
Well, it was close, convenient for home.
Okay.
You know, closer for me to home than the other spots.
Okay. And was it hard to get in? Were they nice to you on the front desk?
I got an appointment the same day.
Same day? Awesome. That's great.
Yeah.
Yep. Fantastic.
Yeah, everybody's great.
Good. Thank you.
So we got Natalie here. She's having a few issues with headaches, so we're going to be needling at the base of the skull. Oftentimes a huge cause of headache, especially the tension type headache, which is so common, is these muscles being overactive. And she's also having a little bit of pain going to the jaw. Very common with this. All of this musculature is connected here. And then also got a little bit of low back pain. We'll be putting some needles here, and then later she'll do some ice for the pain she's having in her legs. So I'll just rub in some alcohol to disinfect the skin. I'm not implying that your skin is infected, but it's just safe. Alright, so that's just a 1-inch needle. Start in the middle here. How you doing there, Natalie?
Do you want elbows down to your knees? Would that be more comfortable? I'm okay, but thank you.
There's another Natalie right there.
Yeah, there's 3 of us right now.
There's 3 Natalies in the room at once?
Wait, what? Guys, it's incredible.
There was another Natalie.
Oh yeah, right here before.
Yeah. If you came in, then it would have been a triple nat. A very rare occurrence.
What are you saying?
How you doing there?
I don't know what you're talking. Kneel.
It's really tight back there. The suboccipitals here. There you go. I was gonna do 2 more right here, alright? There you go. There you go. Sorry. Damn, do your arms get tired?
Sometimes.
One more little push here. That was pretty tough, man.
Comfortable?
Yep.
Do you want to fill under your knees?
No, I'm alright.
All right, stick your mask on. Dr. Shacks, you have one afterwards.
Thanks, man.
Did you pull it here?
Anybody doesn't know where they're going.
Go one more on this side.
Cross my T's and dot my I's.
Deep breath in and let it out. There you go. I'm gonna come right here.
Do you want your phone?
No.
I'm just going to close your eyes.
Good.
Exactly. Can't see anything anyway, so.
Alright, that's a lost needle, Natalie.
Where's your wife work?
GW.
Where are you guys going to New York?
She got a job.
Push there. Perfect. Doing great. Just gonna come back here and get this one a little deeper, alright?
First year of residency at GW. So,
There you go. Awesome. We'll leave it at that.
Everybody, it's Dr. Warren with Robin here today in her fancy mask. We're going to be talking a little bit about, what are we going to be talking about today, Robin?
What do you want to talk about?
I just want to show you how I'm going to work on Robin. She just had a hour-long massage with Arturo, who is fantastic at what he does. So combining soft tissue work and adjustments can be really effective for musculoskeletal issues of varying ranges. Joints, muscles, they go hand in hand. Which came first? What problem came first? I don't think you want to argue that one as much as just fix them both, because they're both involved in most cases, right? So for Robin's case, we do a lot of work on her upper back, soft tissue work in those areas, and I'm going to show you how I adjust her from the amount of work that she does on a clipboard. She's in the hospital setting, going from family or individual or patient to patient. And standing up, sitting, and here all day long. And now a lot of people are suffering from a little bit of this pandemic posture, if you will, where they're just sitting more at home. Your job just naturally puts you a little bit more rounded. You're you're a caregiver, if you
Yeah.
will. You give care to people. You're all
I'm
out
always
here.
doing things.
You're not taking
I'm either
things in. Right?
Yeah, when I'm at work, we have to watch the board in the ER, so we have to watch what's coming in. So I'm on the computer, and then like say I'm in a psych eval with a little kiddo, or something. I'm in a patient's room.
You're down low.
Yeah, actually, I squat down like this,
Right.
and I'm like, so let's talk about this. And after like 5 minutes, my legs go dead. So it's really embarrassing, but.
She's got two major
yeah.
areas that I focus on with her. One is her psoas muscle,
Yeah.
and I adjust her a certain way in her mid-back so I don't cause any discomfort or tension in her psoas to occur. And then I'm going to show you how I do a little bit of soft tissue work on the upper back muscles, something that's really, really awesome to learn how to do. I do this on my wife at home all the time, and just some simple tips can kind of really give you a great skill set of just helping out your loved one. So if you're watching and you're looking up for some tips, just some ways to relax people's shoulders, this is very effective.
Yeah.
So
The other thing that's been
Go
an
ahead.
issue this week has been my feet, and they've been dying. And I think that's like a lot. It's not just me. I'm sure a lot of other nurses and doctors are having this. But
Same.
even if I'm wearing like really good sneakers or
Sure.
anything like that, just the fact of being on my feet for a long period of time, I'm sure you understand. It's just like it's now both feet in like this outer area, and just like unfortunate. Like I went running yesterday, and not only am I just out of shape, but I had to stop because my feet were hurting too. But I was like, I can't even run. So, yeah, there's a lot of things that just like everything down the chain just kind of goes haywire.
So you'll see the beginning part where I'm really focused on what her treatment plan is, and the majority of our focus is with her exercise or PT or adjustments, the soft tissue work. She's getting a lot of different therapies here. But then I'm going to kind of add in a little bit of footwork and show you how I deal with someone who's got tension in the bottom of their feet. Which I'm happy to.
I have tension in a lot of places. Yeah.
People do.
Yeah.
It's good to know a chiropractor.
Where are we going?
We're gonna go right here.
Okay. He forgets that I'm
See you,
blind
Ducky.
all the time, every single time.
Sit here for me. Let me hold your hand so you can make it to
Oh
the
my
table.
gosh.
There you go. Interlace your fingers like so. And rest your hands right on top for me, and then sit up tall through your torso. And it's gonna be very comfortable in the sense that I'm gonna put a lot more compression. And then you're going to be lounging here, okay? Good. Take it easy breath in. And let your hands come forward just a tad more. There you go. Good. Breathe in. And exhale. Keep those fingers together. Now let everything just rest. Good. Now let your feet drop. That's good.
That was good.
You good? Come on. Okay. So now you can go onto your back for me. So that's a really nice way to open up the thoracic spine, focusing on really those lower thoracic segments. And I'm keeping her in a little bit of flexion when I do that, just so she has better movement.
Yeah, it really helps. I think you need an
Los
adjustment.
pies. ¿Sí? Se
Los
duele aquí.
pieses.
Los pieses. Se duele.
Se duele.
Se duele.
Le duele.
They duele. They hurt.
Oh yeah, it's like the outer edge and like the fourth knuckle thing, and then the right heel.
Mostly on this side?
I mean, both are pretty equal, but yeah.
Yeah.
Running yesterday was the right heel. And then both of them pretty equally on the outside. Yeah. Trying to get that stuff that climbing
Yeah.
down or whatever. It smells so good. I feel like one of the things you guys don't realize is how much aromatherapy goes on in this practice. Like all the like cells.
I smell amazing.
Yeah.
It's me. It's not.
Yeah, sure. I caught Marissa too in the session yesterday. She was like,
Who's Marissa? Who's
this
that?
one's wife.
My wife.
She was like kind of like doing this, and I was like, do you need to stretch? And she's like, oh, I'm so sorry. I'm like, no, don't be sorry.
It's because she's still rock climbing.
That's great. That's awesome. That's amazing. That's how it
It's a lot of things. My wife is
She's
38
incredible.
weeks pregnant. She's got this rock climbing harness that she's rocking.
She's amazing.
It's a good workout. She loves it because it doesn't stress her abdomen.
I mean, it's
all
really
back
good
and legs.
for, when the zombie apocalypse happens, that no matter if she's creating another human being.
Or not, she's fit and ready to roll. So there's a lot of different layers of muscles and tissues in this area, and I'm going to focus on a little bit more of the plantar fascia. So I'm going to roll your feet back, tuck your toes. I'm going to work into this space that's really, you can just tell she puts a lot of her pressure on the outer edge of her feet when she's standing.
There's a lot of, I think...
It's not like it's callous, but it's just firm.
It's like I'm so mindful of my posture throughout the day because I'm trying to correct so many things about my posture that are causing all the other issues that I feel like it just goes right down into my feet because and plus like I'm very clumsy. Like part of ADHD also tends to affect coordination. So I'm constantly catching myself and running into walls and stubbing my feet. Yeah. And it's not just me. I thought it was, and I started meeting other people, and they're like, yeah, I'm the most uncoordinated person you'll ever meet. Which is funny, because I'm very active, I like to dance, I like to do all these things, but it's just, yeah.
Okay, toes back for me. You won't fall here. You're in a safe space, Robin.
I'm in a very safe space.
You're not going to fall off the table. The table's not going anywhere. You can't clump
Gravity
your way.
is not my friend. Oh my gosh, I had this patient. It was hilarious. I was speaking to him in Spanish, this old Cuban guy. And he was like a history of falling. And he also has an alcohol use disorder. And he says to me in Spanish, he says, you know, they told me the floor can kill you. The next time you fall, the floor could kill you. I'm like, what?
Who told him that?
Some doctor. Trying to like scare him.
That's not honestly. You know how many people break their hips when they're older?
They're a victim of gravity. Yeah, it's like all of shock trauma. It's like when you see someone who's like over 70 and shock trauma, it's a fall.
Fell.
Yep.
Balance, people. Start doing strength training.
Yes, mobility training is all ages. And please ask for help if you need it. It is not embarrassing to ask for help. It's more embarrassing to ask for help if you're in the hospital bed and your hip is broken. But you know that's.
So I'm just checking the navicular.
Yeah, that when you're doing that,
metatarsal.
like turning it, it's definitely. I don't want to say it hurts, but it's tense.
Yeah, just the talar dome or the mortise joint. Relax. Good. Get yourself nice and centered here for me. Gracias. Levántense su cabeza, por favor. Sí, bueno. Será la mesa al lado aquí. Abajo. Su pelo.
What?
Your hair? Pelo?
Yeah.
Pelo. Okay.
What about it?
Nothing. Just saying, just naming the little vocabulary I know in Spanish. Relajar totalmente.
El cuello.
Rotate. Rotense. Su cabeza a la derecha, por favor. Y relájate.
Or relájense. Depends on how you want to refer to me. I think you can use the two with me.
Say.
It's just easier. I've learned it's just easier to learn usted. So that you don't make a mistake. Yeah.
It's just respect.
So relájense.
Relájense. Su cuello a la derecha. Bueno. Perfecto.
I was so distracted I didn't know you were going to adjust me. Good job.
Gracias. Bueno. Los músculos un poquito cortas.
What are you trying to say?
Son cortas, like a little tight.
I actually don't remember the word for tight.
Cortas.
Cortas is short. Corto is short.
Sí, bueno.
I have to look it up. I don't remember.
Bueno, más sí. Bueno.
That's good.
Okay.
Woo, it tingles.
The tinglies.
My neck tingles.
Good? You feel better than when you first came in.
Absolutely.
Yeah, right on.
Look, I caught myself, so I'm getting better. I cursed me too much.
It's so good to see you.
Yes, it was good to see you.
As always, thank you for watching.
He needs stretching.
If you speak Spanish out there and want to give me free lessons on my terrible vocabulary,
We could start a Spanish speaking group. Let's do it.
Yeah. Oh, and if you stand all day, and you just find a good chiropractor near you, someone that's going to take care of you, listen to you, work on you. If you're here in Baltimore, we're happy. We got a family here of myself, my dad, my brother, Antoine, Nick, Shax, 3 new chiropractors on the team. We're happy to help out, honestly, genuinely.
It's good stuff.
Cool.
It's good self-care. Important.
Take care of yourself, people. Control your environment. Only that one. Don't worry about all the other people's environment. You know what I mean?
Guard your peace.
See you. Hey everybody, it's Dr. Ward Kalkstein here at Kalkstein Chiropractic, and today I'm with Bella. Bella's got her mask down today because we're going to be doing some soft tissue work on her jaw. You've got mask jaw.
I guess so.
Mask jaw. It's a new problem. I feel like over the last 2 to 3 weeks, I think these masks are catching up with us a little bit. So much compression, so much always having to have our mouth shut, not naturally being able to relax it. It's almost like you got a hammock lifting your chin up all the time.
Oh.
And you've got some serious popping and some noise going on in your jaw, right? How does it feel when you open your jaw?
It hurts a little bit.
Where does it hurt? But where's your popping?
I don't know which side it's on.
You don't know?
No, because I was told it was here, and then I was told it was here.
Okay.
I think it's over here.
I think so too. Just watching you move, right? And usually when I see someone and their jaw opening up, the side that's going to pop or make that noise or that loud sound when you open, there's a disc that sits on the top of the joint, right? So this is your mandible coming down like this, and it scoops, right? And this is the tip of that joint. So it's like this. And when you open, it goes like this. Right over the top of that thumb point, there's a disc or a little soft tissue sitting over top that gives it some cushioning, right? Sometimes when you've got a little shift in the jaw, like you got going on, notice you're a little tighter on that left side. Your right side gets a little bit of an audible because that disc is making a little noise as the jaw opens up, okay?
So it's this side making this side clonk.
Good job. Yes, a lot of times. Not all the time, but in your case, yes. So how do we fix that problem?
Stick your finger in my...
Is that how we do it?
Yeah, you just...
Taking notes, Bella, aren't you? So Bella, come up on your back for me. We're going to do some soft tissue work on her masseter and the pterygoid muscles, as well as masseter.
Masseter.
Say it.
What is it?
Masseter.
Masseter.
Masseter. Go like this and go. Arr.
Oh.
You see how that tightens up out here? Put your fingers over there when you do it. And do it. Go. Arr. You feel like it's hard?
Yeah.
That's the muscle that tightens up and closes your jaw. Okay?
Oh.
Yeah. So, gravity opens your jaw up. And then there's a muscle here called your mylohyoid that opens up your jaw a little bit. But really what it does is it takes this chin and doesn't allow it to go up. It scoops it down and back. So open your jaw for me. She does an okay job doing that. Okay. But what I want to see is the tongue lifting up a little bit more. And I want to see the chin travel down a little bit more. Good. And then close. Okay, so I'm going to palpate and I'm going to feel what's going on with Bella's jaw. So first, open up for me, Bella, nice and slow. Keep going. Good. And I feel that clunk, that disc slipping a little bit. Nothing that is going out of place, don't worry. It's just creating a little bit of a cavitation or a noise like that. Okay?
What is that?
Hard things moving over other hard things. Just like your jaw opening, there's a hard thing moving over another hard thing inside. That's why you get that noise, okay? So, you're still amazing, Bella. You just got a little clunkiness going on here.
Clunky okayness.
Some clunky okayness, yes. That's your diagnosis today. So we're going to work on some of that discomfort, jaw tension by working inside the jaw, opening up a few times. I'm going to teach her how to do some soft tissue work on her own.
Kind of do the flow.
No, none of that. You're going to be doing some more work on the outside. That helps calm down that. So what was that muscle name again?
Oh, what?
Oh,
Starts with an M.
If you get this right, you might have an internship here one day.
What? It starts with an M.
Go for it.
No.
Send it. What is it?
No.
Bella.
Master something.
Master. What?
Master something.
Master something?
Yeah.
Master jaw? The master jaw muscle.
It's a master jaw muscle.
The masseter.
Oh.
Try it again.
Masseter.
How do you remember things well, Bella? Are you a visual learner? Do you have to read it?
No.
Do you have to say it?
Depends what this.
Do you have to create a story around
I
it?
got going on. I guess let's create a story.
Story of the masseter. Caused by the...
What?
What are we calling this? What are we calling this syndrome coming in lately?
The clunking okayness.
The clunking okayness?
The clunking okayness.
Well, that is as a result of the mask jawless. So because of the mask, people are having more jaw discomfort, seeing a little bit more tension, just tension, stress, neck pain. Those can all be associated with TMJ disorders, temporomandibular joint disorders. That's what this name of this joint is. Okay. And so we're seeing a little bit more of it, right? And this week especially, I think I've seen 10 people
So the
this week.
mask is doing it?
I think it can be a contributor, like just having your mouth shut all the time, people in tension, stress from the neck, right? Those type of things can bring people in, right? I would say that people sitting at home more often, causing, upper back tension, neck pain, doing a little bit more desk work from home, not kind of getting out of the house, not moving as much, maybe not kind of transitioning between workplaces so much, a little bit more sedentary. That can cause a little bit more isolation, stress, sitting, tension, things you don't need to worry about yet because you're not you're working.
Yeah, I do work.
Oh,
now.
working girl.
You can say that now.
Oh, you can say it. You're a hard-working girl. Where do you work?
I already told you.
I know, this is for them.
Chick-fil-A.
Chick-fil-A. So you work at Chick-fil-A now? You having fun? Saving up?
Yeah. I haven't spent any of my money yet.
You should go check out Dave Ramsey. He's a great guy in terms of understanding how to save money and why it's important. You want to do that? You want to learn how to save?
I'll learn how to save my money.
Be financially independent and free?
Yep.
You don't have to worry about that yet.
Yes, I do.
Yes, you do.
18 next year.
Holy smokes. No, you're not. You're
Yeah.
still 13, aren't you?
Because I'll be 17 this year, and then next year I'll be 18.
How old do you think I am?
32.
32?
Yeah.
30.
Oh, I was close. I was going to say 30, but then I was like, you just
went
got
high.
married. Yes, but...
Alright, go ahead and relax for me. Try to be serious right now, Bella, because I'm going to be working on that muscle. It's going to be a little uncomfortable. I'm going to get a little more focused, okay?
Go ahead.
Alright, and once you get in the Zen mode, it'll be like you're playing lacrosse, okay? You got that mode turned on?
Flip it in.
Flip it on. I'm going to do the flipping and flipping. You flip on the lacrosse switch, okay? Go ahead and open up for me. Good. And close. Good. Open up nice and slow for me. And close. Gently open. Right there is good. Now open more. Good. And close. Open. Close. Open. Close. Gently open. Easy right there. Relax. Good. Open. And relax. Good. Open up. A little more pressure here. Good. Close. And open. Pause. Open. Good. And relax. Good. Blah, 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 blah. Okay. Open up for me. Good. And close down just a little bit. Good. And open. And relax. Relax, relax. Don't close, just relax. Opposite of doing anything at all. Do nothing. Loose, loose. Now close. And relax, Bella. Loose. Let it open up. Let it open up. Good. Now relax it all the way. Kind of just go loose. There you go. Good. And close. And gently open. Easy. Now don't do anything. Relax. I'm going to stretch it. Good. And relax. Not a good taste. If these were strawberry flavored, it'd be a little bit better, huh? Yeah. We'll do that next time for you, Doc.
Just put strawberry on your gloves.
No, not like rub strawberries on them. They make gloves that taste better.
Do they really?
Huh?
Wow.
Sure. So, now we're gonna work the jaw side to side, okay? Go ahead and open up a little bit for me. Good. And relax. Just gonna let me kind of take control. Good. I'm gonna put a little pressure here. I want you to push your chin to my hand, like you're kind of kicking my hand out of the way with just your chin.
That way?
Yeah, but just hold the pressure, okay?
Okay.
Go ahead and push to the side. Good. Now relax. I'm gonna take you across. So it's gonna look like this. I'm gonna push, and then you're gonna feel a stretch. Okay, sound good? Cool. Go ahead and open. Good, relax. Loose. Good. I'm gonna push you across. Good. Keep pushing, engage that muscle. Good. And relax, easy. Hold on. Let it come across. Wait for it. Keep letting it go, There's gonna be a little stretch. There you go. And breathe. Easy. Push across. Good. And let it come. Good, much better. You feel a little stretch. Good. And push. And let it come across. Easy. Good, and relax.
That's so weird.
The
I
feeling?
can feel it, like.
Pressure building up over there? Yeah. So the joints are connected. You gotta feel how I'm pushing over here. It's putting pressure on the opposite side. Cool? You doing good? Okay. Now I'm gonna do a little soft tissue work on the sides of your cheeks, okay?
Go ahead.
Go ahead. Okay. Bella, you're a working young lady now. You're excited to be. You show up on time for work?
Always. I'm always 15 minutes early.
You say you're on time for work?
Yep.
That's what I'm talking about. How many days have you been working there? How many weeks?
I've been working since the 3rd of this month, and I work like 3 times a week, usually.
Good for you.
And I'm old now.
Now that you're older now. You're the oldest of the siblings, right? You gotta lead the way. Show them how it's done. Go ahead and open up for me. Good, and relax. And open. And relax. That feels good. Open. And relax. And open. Almost there, Bella. A little more. Good. Rest there. So there's a couple muscles that help close it. That sounds and feels a lot better. How's it feel to you, Bella? Not as much big clunk, clunk.
No clunky okayness.
No clunky okayness, just greatness. This jaw is great.
Greatness.
Just pure greatness. So now we're going to do a little work on a muscle here called you ready for this one? What is this part of your forehead called?
I don't know.
Your temple.
Oh, I could have gotten that one.
So this muscle is called your temporalis. Temporalis, yep. It looks like a seashell.
It does?
Yeah, kind of. The lines of it do. There's a little bit of a circle here of lines, and a circle here of lines. All those muscle fibers come down here, and they help you shut your jaw.
Oh, my forehead shuts my jaw.
Your Next time your mother no, I'm just kidding. Next time someone tells you to shut your jaw or to zip it, you can say, "You tell my forehead to shut my to close."
My forehead to close.
I can't do it. My forehead doesn't work, ma'am.
My forehead muscls are broken.
They're broken. I have a diagnosis. I have a clunky okayness jaw with some
bad forehead.
Forehead. Here it is. So I'm gonna see that little tension that builds up right here, over there. I want to put a little pressure into that muscle. It's not a knot per se, it's just a little sensitive point within the muscle. And then you'll feel a little bit of pressure and it should feel good, but not too much, okay?
There's a knot on my forehead.
There's a knot on your forehead.
I didn't know they were deep enough on my forehead.
Belle, open up your jaw for me. Good. Close. That's exceptional, Bella.
Right.
From greatness to exceptional. Open. Good, and relax.
Doesn't go.
Why not?
I don't know. Magic.
Magic. Open. And close. So, Bella, how can you help create a little bit of better movement at home? Bring your hands up towards me. Put your fingers here. Okay? Find the edge of that joint. Okay? And then what I want you to do is not so pointy. A little flatter. Look at these nails. What do you got nails for? You're still 13. You don't need painted nails.
13. My sister paints hers. She's 11.
Are you driving?
Yes.
Oh, God.
I drove here and I drive to work.
Help me. So, Bella, fingers come down. Find the muscle. Make that R face. Feel it? Now relax that loose. Open the jaw. Keep coming down with your fingertips. Push it a little harder, Bella. Come on. There you go. Not too hard. You feel the muscle now? Good. And now open all the way as you pull down. It's a nice gentle stretch. Good. And close. Fingers back up. Good. Slide. Open. Good. You might be wondering how often to do this, right?
Yeah, how often?
How often, right? Okay, so
Every day,
you got to be a little bit of a
times.
body detective for yourself. I would say before meals is a nice, safe way to start. If it's helping you, keep doing it that way, okay? Until you find a little bit more balance, you don't need to do it as often. If you're feeling tense, if you have a lot of stress, if whatever, and you're feeling tension build up in your jaw, you can do it a few times. If you're doing it so much that your jaw is sore, what do you think you should do?
Stop doing it.
Stop doing it as much. Okay,
How
good
many
job.
times?
How many meals
Should
a day do you eat?
No, like how many times do I?
Good. How many reps?
No, yeah, reps.
Reps. Well, yeah. How many times? 10 times. Nice and easy. Make it simple. Okay. I usually set a timer if I need to do some type of mindful stretching or body work on myself to take care of myself, because that timer keeps me a little bit more accountable than just what I feel like doing. Okay. Sound good? So for you, 10 times or 2 to 3 minutes.
Okay.
Cool. How many times?
10 times, 2 to 3 minutes.
So for when?
Before I eat.
Nice. Okay, and then we're going to work on this because you don't want this thing to be out of alignment for a long period of time, because then that problem can build up a little bit. The disc can change a little bit, so you want to keep it moving well and healthy. So you don't have nothing to worry about though, okay?
Okay.
Cool. Okay, now I'm going to show you how I treat Bella's neck, okay? She's coming in, she's got some neck discomfort. We adjust Bella periodically around once a month for maintaining good health and mobility in her cervical spine and her upper back, okay? She finds that, especially when she's more active and she's a little bit more active with lacrosse, it keeps her neck feeling really good. Her range of motion stays really good, stays fluid and full, if you will. She doesn't have pain or discomfort. So she's getting ahead of this problem. And for today's visit, we're a little bit more focused on the jaw, but I'm going to show you how I treat her neck as well. Sound good? Cool. Right. So I'm going to do this for you, Belle.
Go ahead.
Hold that. And relax. So the majority of Bella's neck moves really well. She's got a little tension at the base of her neck, and she's got a little tension in this rib area here in her lower cervical spine. So if I'm counting down, you want to count with me?
Sure.
You want to feel what I feel? Go. Relax. Oh, come on. Relax. There we go.
Got a
Good.
big head.
You did?
Not really.
So I'm going to count. Ready? Loose, 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 loose. There you go. See 1. C2, C3, loose, loose, 4.
Wow.
Easy, easy. You're trying to help me out so much. Relax.
I can't.
5. There you go. 6. Feel this little sticky part right here? This sticks out a little bit. C7.
Oh, so my C7 is wrong.
Needs a little loving. Needs a little work. Needs better movement. There's nothing wrong about that. Just hard work. You do a lot. A little stress. You're just taking care of your body. Yeah. So we're going to get a little more motion to it, okay? A little pressure. Loose. Good. And then drop your shoulder. Good.
That was
Simple.
quick.
Was it quick?
Yeah.
Yeah, it had to be because you're like this. Turn your head this way. Good. And relax. Good. I think I got your ear.
No.
And loose. There it is. Nice and simple. Turn your head to your left. Good. Rest your hand here. You're gonna feel some pressure in your upper back, okay? Reach across and hold. And let it go.
Click, click, clack.
Click, click, clack. What's that noise?
That was what my back did.
That's what your back did?
Yeah.
No, I know that, but what is it?
I don't know.
Turn your head that way. Reach. Loose, breathe in. So when there's pressure over a joint capsule, like this tissue right here is a little tense. You're gonna feel looseness. Feel it kind of plunks in. Am I putting that joint back in place?
No.
No. What am I doing?
I don't know.
Come on. You've been coming here for a little while. What do you think I'm doing in your
I
words?
don't know. Something to my ribbies that's going on over there.
Oh, come on.
I don't know.
So there's pressure over the joint. You want to see the spine?
Yeah.
Come on. If you want to be a PT or a chiropractor one day, you got to know your stuff. What is this?
Spine.
It's a spine.
Yeah, it's a
It
spine.
is a spine. So, and what are the individual things called?
Oh, wow.
Vertebra?
The vertebrae?
Yeah. So this is the back side of the vertebra, or the dorsal part, okay? It has a couple different key features that help you move well and protect something called your spinal cord. See that little rubber part that's kind of sticking out here? Those are your spinal nerves. And the center is part of your central nervous system. That's your spinal cord. You see how built up this thing is? Doesn't it look almost like, I don't even know. It's wild, isn't it? It's like armor. It's like your nervous system has armor, right?
It does have armor.
It does have armor. You're pretty awesome, aren't you? Yes, you are, Bella. You're amazing. So, in the back side of this armor, you see these little slits. What do you think they help you do?
Move.
Yeah, sister, you got it. Okay. You got common sense, Bella. So, they help you move back. They help you rotate. And around them, there's some fluid in between it, right? And there's a little capsule around there. So when there's tension in the muscle tissue, or there's a little postural strain, you kind of get stuck like this. Oh. Some people go like, my neck's out of whack, or I lock my neck, or my back locked up on me. Muscle tension, joint irritation, and the joints kind of get stuck. The adjustments help free up range of motion. The pops that you hear are just little gas bubbles releasing within the joint capsule. It's just an added effect of force and amplitude, or movement. So you get a little tense here. We kind of break up that tension with the adjustment. Nothing breaks. It's just more movement. Muscle tension goes away.
So you pop little gas bubbles.
Yeah, exactly. That's exactly what's happening. Nothing's breaking. Now, fascia, muscle, tissue, that is all interconnected. There can be some scar tissue. There can be a little buildup of that tension that causes the tissue to become a little harder, right? Sometimes when people get adjusted, say for the first time, they become a little bit more sore. Sometimes it's due to breaking up some of that scar tissue. So there's an effect. The noise you hear is just the gas bubble, but the impulse, the movement.
Just putting it back where it goes.
Yeah, moving better, right? Yeah, healthier joint, healthier muscles, healthier Bella.
Yeah.
I'm getting the look.
Are they yelling at you?
You're yelling at me. You're gonna go
with the eyes.
Just the look.
Just the
Keep
eyes.
moving. Okay?
Okay.
So one more adjustment we got to deal with, and that's at the base of that neck where some of this jaw tension is coming from. Okay?
You gonna pop it?
What?
You gonna go like that?
We're gonna treat it like this. So come sit here. And then slouch down a little. Good. A little bit more, Bella. Slouch just a tiny. Oh my gosh, you're getting taller. Here, just scoot just for the adjustment. That's good. And relax. So let your head fall. Good. And you're going to turn this way. You're going to turn this way. And keep going this way. You're good. I'll let you know when I'm going to adjust you, okay?
Alright.
So, I'm going to adjust you right here. Okay? Turn your head this way. Let your head fall. And remember, it's all about healthy motion. You got so many earrings now.
Same amount.
No way.
This way.
Breathe in. And exhale. So I'm going to stretch you, Bella. Good. And I'm going to get compression. So what you have to do is pretend like you're resting here. It's a lot of trust in me, okay?
Okay.
Good. And now I'm going to stretch you. Good. And feel that pressure that builds up. Good. So there's a little gap there, a little release in that pressure. Now turn your head to your left. Good. And to your right. How does it feel?
Much better.
How's your jaw feeling?
Good. No poppy.
No poppy or clicky? We good?
Mm-hmm.
Okay. So, for Bella's jaw tension, the mask wearing, she's had a little bit of a history of it. She had a little bit of history of neck problems in the past as well. That can all correlate to this type of problem. We did soft tissue work on this muscle called the
Something.
masseter. Masseter. And then the, what's the temple muscle called? Temporalis. Good job.
Yeah.
Nice. Not even seeing the word. That's impressive. And then we adjusted the soft tissue work on the pterygoids. We did what's called PIR, some muscle work on the pterygoids and the masseter as well. We stretched her out a little bit. We gave her some home exercises. We talked about what the adjustment was. We adjusted some of the joints in her upper back and her neck that might be contributing to some of this neck pain. And then the last adjustment we did was called an occipital lift, where I'm lifting this segment back here that gets a little tight and irritated on Bella, to give her a little bit more release and just to make sure that the joints that support the jaw are moving well as well. That was a mouthful.
That was a lot.
That was a lot. I'm sweating. I've only seen one person this afternoon.
Really?
No, I'm just kidding.
You had to have seen more.
No, you're the first person.
No, there's one before me.
Was there?
Yes, there was.
Ah, there was two before you. She's an AAU basketball player.
Oh wow, that's cool.
Yeah, you're gonna be an AAU lacrosse player if they have that.
Possibly. I don't think they have that.
Yeah, girl, you're nasty. You're gonna be good. My sister was pretty good.
No, I know. I heard about
You heard about her?
Mm-hmm.
She's a good lacrosse player. All right, everybody. Thanks so much for watching. I hope you guys have a great day. If you have any questions about jaw pain, neck pain, what chiropractors do to help, or